This is Straddle Princess, and if I make it out of here alive with these Q-tips stuck all the way down my nose, please come send help. Just kidding. I'm finally actually getting a second, well, probably more like the 12th opinion on why I lost my voice, why I have chronic cough, nasal drip, and all of the things. And so hopefully this works. This feels so uncomfortable. It feels like a COVID test.
It's not the... This is quite minor.
It's a minor?
Yeah.
Oh, this is so uncomfortable. I never had both
Never
in
had
my
both?
nostril. Usually, like, it's just... Well, the first time I did it was COVID test.
Oh, wow, it's all sticky. Okay.
It's all sticky, so
Yeah.
what's that mean?
It means your body is still thinks there's still some inflammation.
Yeah, it's the lupus. It's
Yeah.
constantly
Yeah.
like my immune system is just overreactive.
Yeah,
It's
so
still what? How did you describe it? It still thinks, or
It's still inflamed.
it's still inflamed.
Yeah.
I've been inflamed.
Since that.
So what is it? December, January, February, March, April, May.
Yeah, I saw your record.
7 months.
Yeah.
7 months inflamed.
We'll do some adjustment.
I know.
No? Okay.
Oh my god. Oh wow. Should I breathe through my nose or just hold my breath?
It's okay. Very mucus.
Very what?
Very
Mucusy?
sticky.
Very
Very sticky.
sticky.
Very
What does
sticky.
that mean when it's that sticky?
It means the inflammation is pretty long, prolonged.
Prolonged
Yeah,
inflammation.
yeah,
So my body is currently thinking it's under attack.
Yes, and then when you spit out the sputum or the drip, it's all like jello.
Yeah,
Yeah, it's like jello.
it's like gelatin.
Yeah, it's like gelatin. Exactly.
Exactly. Oh, you're such a good doctor. You know how I feel.
And
It's annoying.
a lot of people come here for
Huh?
this kind of problem.
What'd you say?
A lot of people come here for this kind of problem.
But do people have the problem as like severe as mine?
You mean somewhat, yes.
Because they also have SLE
Yes, some immune problem.
response, like they have an overreactive immune system. Ooh.
To feel more clear.
Yeah, but the thing is now it's here,
Yeah.
and I want to go like,
Yeah, exactly.
and
So
that's
why-
the annoying.
That's the other part we're doing now.
But
Your nose
even
is,
if you do this, it's still gonna produce. So
Yeah,
like,
yeah, yeah.
so what does, how did, like this just clears it up for now. You know, in 1 hour, it'll probably come back.
we're checking the color and the consistency and
What-
to see which part is causing.
So that's what you're checking for color and
Yeah,
consistency right now.
yeah.
So how
That's-
is the color and consistency
it's
besides
pretty green.
pretty green, right? Like I showed you the
Yeah,
picture I took from this
it's pretty
morning.
green, so we need to make sure. Oh wow, it's very sticky. Okay, again.
Oh.
Wow. Very, very sticky.
And green,
Yellowish.
yellowish green. It sometimes fluctuates between clear,
Yeah, yeah.
yellow, and green, and it's just like that on rotation. But it's very.
Oh, yeah.
Oh,
Okay.
crying.
Okay.
I'm tearing.
Okay. Very, very sticky. Very.
Yeah. It's weird because I go to these doctors, they almost just kind of dismiss it, like, oh, no big deal, it's just bronchitis, and then they prescribe me some pills,
Yes.
some liquid, and I'm like, okay, blindly listening to them, and then it doesn't get better, so I get kind of frustrated with the medical system. Not to disrespect, you know, your profession or like this entire Taiwan medical system, but it's kind of difficult when I've been having trouble finding like how to treat, because I feel like a lot of people don't really know how to treat people with SLE, like in Taiwan. It's just more advanced.
Maybe just a language barrier.
A language barrier.
Maybe.
I went to like the Taipei Medical University Hospital. That's like the main place that I go to.
Okay. Yeah.
And they all speak English.
Yeah, I graduated from there.
You did?
Yes.
Yeah.
I did.
Did you like it? The one here, right? Close by. Yeah, right there.
Xing area.
Yeah, Xing area.
Yeah.
Did you like it? Did you think the education was good? Like, I like that hospital a lot.
It's good.
But then I started having problems because I've had SLE, and the more I go to these doctors, it's like the less they can help me.
There's 3 things we're going to solve today. Okay. One is the sputum.
Sputum?
There's way too much sputum.
Yeah.
Okay, so we need to help you decrease it, because I check your medications. There's only, maybe because the hospital system, they cannot prescribe extra medication or anything.
But the clinics can?
Yes.
Why?
Because they're under more strict
The
guidelines.
clinics can.
Yes.
They're under more strict guidelines?
In the hospital.
Why?
That's how the system works. Because usually the hospital is for severe people.
But I am severe.
And pneumonia require in-hospital care, you know.
I thought this was pneumonia.
No,
Okay.
It's
Well-
very severe bronchitis.
Very severe bronchitis. I mean, they said that.
And then what did they say? You check up and stuff.
I checked up. I went to 2 different doctors, like 2 different kinds of ENTs, my pulmonologist that I always go to, who basically said, I think you should get like another opinion. Gave me like another opinion on top of that.
Okay.
And so I just started losing faith in the ENT clinic, like in general over there, because they even put the camera probe.
Yeah, no, I saw.
Everything was
report.
clear.
Yeah.
And that was when I had the worst symptoms, like loss of voice, and they're like, oh, it's just pharyngitis. So they dismissed that. I even got a chest x-ray, that came clear.
Yes.
So, like, my pulmonologist finally just said, like, we're all just kind of scratching our head, but very severe acute bronchitis is just such a general term for just, like, feeling like shit.
Mm-hmm.
Because bronchitis is so general.
Yes.
So, like, is there something a little more specific that I can finally understand what this is? Because I've had this before, like 10 years ago.
Usually involves some bacteria,
So it is an infection still.
but it's more of a, how do you say, it's not severe enough that causes pneumonia, but it's there.
Yeah, it's getting there.
It's either, we call it a typical bacterial infection.
A typical bacteria.
Usually it's,
Well, that doesn't seem too bad.
it's like a mycoplasma.
Right.
Or
That's what my pulmonologist says.
Pertussis.
Pertussis?
Is also possible.
What's pertussis?
It's a bacteria that causes chronic coughing.
Oh, yep. I think that
Yeah.
that sounds like something I would have.
Yeah, so either that or it's we call it in those family.
In the family?
Of those bacteria.
I see.
Yeah, so I check their medication. Usually, when you take it, do you feel better?
The medication that I was on?
Yes.
No.
Before.
No.
Previous, no.
Not really.
Do you feel the sputum comes out? No.
It does definitely loosen up the sputum
Okay,
for
but-
sure, but it
It's still
doesn't.
there.
Yeah, like it's just that white tablet that dissolves the
Yeah,
acetone
yeah.
or whatever. Like that just loosens up my
Yeah.
cough, and then I have that brown liquid.
Yeah,
The brown. I don't like that liquid. What is that for? I mean,
it's for coughing.
but then why did they put opium in it?
Opium
A little bit. Why?
is for anti-cough.
Pain,
No. For cough.
anti-cough.
Yeah. Opium is for the coughing.
Isn't it like addictive?
No, not that.
Not in-
amount.
not in that little
not in that
quantity.
amount. Yeah, it's just very very small.
It's for anti-coughing.
Yeah.
I thought it was carcinogenic too.
No, that material is not.
That material is not. Okay.
It's very common in Asia to use
in Asia because it's illegal in the States. That's
No,
why I
there's
was.
too much drug abuse in the States, so they usually use it. They take the cough medicine and they do some lab stuff and they.
Right, because I looked it up. It was carcinogenic. That's why it's like a little. It's like I forget. I can look it up. Because it was interesting.
So you live around here?
Yes. So then with what you're prescribing me, is that going to help with my
Coughing. And
just
the
coughing?
and
But
the
what about my voice? Like
the
this,
voice also. Because
it'll
the
go
voice,
back to normal.
Your voice is due to
The coughing and like the constant irritation,
and the sputum.
the sputum.
It's
Okay.
very, very thick.
Yeah, my voice is thick. It's like deep.
Yes. And then I don't know if after I sucking out some sputum you feel loosened up.
Well, I feel like my voice got deeper because it's a little more relaxed.
But still
Yeah,
sticky.
yeah. Do you have like the bottle of the brown liquid moisture, like, because I wanted to see the ingredient because when I looked it up they said that like it's like poisonous to rats, and that's why I was like, why am I taking this? I just wanted to see the ingredients because it was opium and then there was like 2 other things that I looked up. So I'm very curious again. Yeah, so this one was the antimony. So the antimony is what I looked up. The antimony potassium tartrate.
Yes.
It like tartar. It's an anemic. So isn't that like very bad? an anemic.
No,
It's like used against parasites.
It has anti-inflammatory factors.
I see.
So
It's weird because they would never prescribe this in the States because it's a powerful anemic.
Yeah.
But it's or emetic. Emetic, sorry. Not emetic. It like causes vomiting. I was like very scared to take this.
No, it's fine. Kids take it. Okay, so
It's crazy because this one has antimony, potassium tartrate, and then the glycerol fluid extract. That one's okay. Yeah, I was like very, very confused. This stuff.
So they will prescribe a week.
1 week. That's what the insurance can give me.
Taiwanese.
So, okay, that's good. Cause usually it's 3 days, but you're giving me 7.
Yes,
Cause I'm really serious.
And also, our diagnosis is chronic, so you can go a bit longer.
A bit longer.
Okay, so you have any drug allergies?
No.
No.
Mm-mm.
Okay.
So are you prescribing me the same erythromycin? That's like an antibiotic, right?
Yes, it's for the sputum.
Still need it for 7 months later.
For
Wow.
the sputum.
But most of these are just tablets, no liquid.
No liquids.
Okay.
All tablets.
Great.
And,
Oh, see, so my nose is it feels like I've got like this popping bubbly thing that makes me want to blow my nose. So what do I do? Do I blow my nose or do I just?
You just blow your nose. Let it out.
But then, if I'm constantly irritating my throat and my nose,
It's fine. The simple blowing is fine. It should be fine.
can I blow my shot? Yeah, because now I feel like blowing my nose,
Yeah, sure.
and I don't want to keep doing like the like that stuff is super annoying. But this is what I feel like I want to do right now.
So, 7 days of medication, okay?
Okay.
So you've been in Taiwan for a long time or no?
Yes.
Very long time. Okay. How long?
Since almost 4 years, since before
okay.
COVID.
Okay. So the Mandarin is still working. I'm working on
My
it.
Mandarin is not good. I haven't learned Mandarin. I'm the worst Taiwanese American because I've never been to Chinese school.
So how
And
do you function here?
I honestly, I listen and
Not?
there's an actual term for it where you're learning by, like, I forget, you're just learning by listening. The way that kids would learn, they just, like, that's how I learn. I learn and I remember what they say, and I feel like I use my intuition, and if it makes sense, then I remember the words, and then that's how I get by when I talk.
Okay.
So I'm telling most people, like, I only speak Chinese when forced,
Not
but it's
forced.
very bad.
Okay. So it's very simple, your medication. Just a package for
Yeah, and then I just take it 3 times a day
yes.
for 7 days.
Yes, for 7 days.
And I just take that whole bag all at once,
Yes.
right? Okay.
It's actually 2 times per day.
Oh, twice a day. Okay.
Yes. So there's one package that just take 2 nights. I'll
But
tell you later.
it comes in the bag, and then I take the whole bag twice a day, morning and night.
Morning and night.
Do I need to worry about meals? Like,
No.
if I eat it on an empty stomach, is that okay?
It's fine.
Okay.
Should be fine.
Should I come back in a week or
Yes.
okay.
How about you?
To follow up, or if it's better, then just be done with it? I think we're all set. I've got 7 different kinds of medications now. But you know what? I'm glad I found this ENT. I really like him. I'm gonna come back. I am so fortunate that he is the ENT today and not the other one. So I'm really glad. This is gonna be my new doctor from now on when it comes to all things ENT related.
Okay, so after the medication is prepared, I'll tell you how to eat it. Okay.
Okay.
It should be simple.
Should be what? Simple?
Yeah, it should be simple to follow.
Okay, great.
Okay, so our main goal here is to decrease the sputum in your chest and your throat and your nose.
No, not just decrease it. I want it to stop producing.
Yeah,
Like,
exactly.
yeah.
Decrease,
And then-
dissolve it, gone.
And then it won't, and then my body won't feel like it's having an immune response.
Yes, yes. So actually,
So this is definitely lupus related then,
yeah,
right?
chronic inflammation.
Yeah.
And then, so because your exams are normal, so it's just a very long inflammation causing.
I know, and
other-
every doctor I go to, they like don't know what's wrong, and then when I tell them I have lupus, they're like, oh, okay.
Yeah, but we don't want you to take steroids, but it causes.
No, I can't.
Yeah.
That's why I tell I
Yeah.
don't want to do it.
Yeah, so we're not taking steroids. Okay, you shouldn't be taking.
I
we're
shouldn't be
still-
taking steroids anyways. That's why anytime a doctor prescribes it, I tell them I don't want to take it, or I'll take it, but I don't want to rely on it because
Okay.
you know steroids are not good for you.
Yeah. Okay, so yeah, should be so in a week. Okay,
Okay,
that's good.
sounds great. Thank you so much.
So you live around here, right?
Yeah, yeah.
Very close.
Yeah.
Oh, okay. So you Google it or something?
I did. I was just like, I was just like, I finally have some time. Honestly, I've been sick for so long, but I've been so busy with work that like I couldn't really, you know, just like it didn't really align. But like today, finally, I'm like, you know what? I'm gonna check it out because
Okay.
it's still happening, and I didn't know. Like I had my inhaler refill, like.
Yes.
That I was going to get, but because I didn't get it within the window, I waited almost 2 weeks. They
okay.
said I can't
Stop.
get it anymore, and I didn't know that, so I was like, all right.
It's
then.
okay. So in the future, if you need the prescription, we can provide the prescription, and you go to the pharmacy. To
So
get
I
it.
don't even, and they said even if like the hospital prescribes that inhaler, I can still go to you to
Yeah,
fill
because
it.
we can prescribe the same
Stuff.
paper, and then you can just go
Okay.
to the pharmacy to get it.
Okay,
Okay.
sounds great.
Sounds good.
Thank you so much.
Okay. Okay, and we'll wait for the medication. Okay.
Thanks so much. What's your name, Doctor?
Yu Xiang.
Dr. Yi, Dr. Wu,
Xie, Dr. Xie.
Dr. Xie.
Just ask for the
Yu Xiang.
院长.
Yuan Zhang. All
The
right.
dean.
Thank you so much.
Okay.
All right.
请24
Feel
号
like
就诊。
so much better. He's got great bedside manner. So I love it. And I didn't even have to wait. And this place has like a lot of reviews and like over 4.5 stars, over 200 reviews. And honestly, I like it. I would recommend this place for sure. If any of you can read this, Dr. Xie is the best. Let me see. There's 2 doctors. Wait, no, there's just 1 doctor. Oh well. Anyways. Oh, I'm so happy. Yay, I feel like not only am I being taken care of, he's got great bedside manner, and I feel like this time it's gonna work. I'm hopeful. So now we are on the road to healing my voice so that it's not as hoarse as it is right now. And yeah, that makes me really happy. As much as I love this deep, hoarse voice, I don't think that it is sustainable if I have to continue coughing and having this nasal drip where I constantly want to blow my nose all the time, just so that I can have a deep, sexy voice. It's so gross. But anyways, see you guys later.